We will now begin phase 2. So the first exercise for phase 2, you will need a cane or a dowel or a piece of PVC pipe, something in which you can hold in both hands that's at least the width of your shoulder. So with this exercise, hands about shoulder width apart, starting at your waist. The first motion will be to kind of bend the elbow. Excellent. And then slowly elevate the shoulder above the head with the elbow bent. So as the dowel or the stick gets over the head, it's okay to begin to extend the elbows at that time. With this exercise, there's no limit or no stopping point. Pain would be your guide. You would slowly then begin the descent, and as the arm returns to its normal motion, we'll bend the elbows so it slowly returns to the table. And we'll do that motion one more time. So it's a slow motion up with the elbows slightly bent. As the stick or dowel goes over the head, it's okay then to begin to extend the elbow. No limitations. Nice and slow on the return, with the bent elbow to return to the starting position. Excellent. Our second exercise is the shoulder punch. Here with the patient on their back, elbows extended, arm about 90 degrees bent, or shoulder about 90 degrees bent. Here the motion, the patient is going to have the dowel or the stick in their hands about shoulder width apart, and they're going to punch up with both hands at the same time, elevating the shoulder off the table. Hold for a second or two and slowly return to the table with the elbows still straightened. We'll repeat that punch 2 more times. So here the elbows stay straight, the shoulder comes off the table, the elbows stay straight, and the shoulder returns to the table. One last time. Excellent. Our third exercise is shoulder rotation, both internal rotation and external rotation. So with the patient seated, the arm will come about 90 degrees at the side, forearm in a neutral position. So the patient is able to actively, or with their own power, bring their shoulder in an external rotation fashion away from their body. And back to the return or the starting position. And then in toward the body or internal rotation. So with both of these movements, there is no limitation. The body would be the stop for internal rotation, and then for external rotation, the end of the availability of the range of motion would be the natural stopping point. Excellent. Our fifth exercise in phase 2 is going to be shoulder elevation. So this shoulder elevation is important for many ADL activities or activities of daily life, reaching overhead, washing your hair, or reaching up to the cabinet. So to pattern this motion correctly, we're going to first bend the elbow and then begin to reach the top or the back of the head by elevating the shoulder. Then slowly back down. And we'll repeat that 2 more times. So when reaching overhead with this exercise or into the cabinets, we want to first bend the elbow and then elevate the shoulder. That will limit the amount of work that the shoulder has to do, or the amount of force placed on the shoulder. And slowly back down. And one final time. Elbow stays bent, shoulder elevates, hand goes behind the head, and then a slow descent. Excellent. Now for our sixth exercise, and this will be shoulder scaption. So to begin this exercise, first we'll do two things of orientation, or two steps of orientation. First, we'll establish what is 0 degrees. So with the thumb pointed toward the ceiling, with the arm out by the side, for the purposes of this exercise, we'll establish this as 0 degrees. Now we'll move the arm into 90 degrees. Thumb up, 90 degrees. So for orientation, we've established 0 degrees and 90 degrees. For the exercise, we would like the position of the patient to be about 30 to 40 degrees. We're going to call this 30 to 40 degrees the position of scaption. So we'll bring the hand down to the table, and this will be our starting position. So we'll do 3 repetitions of elevating the shoulder in the scaption position. So the elbow is extended, then the shoulder moves in the scaption position. This is the position that most of us do our activities of daily living in. And one final time. So at 30 to 40 degrees away from the body. Excellent. Exercise 7 in phase 2 will be a simple bicep curl. Patient seated, palm up, simply flexing the elbow and then extending the elbow. Excellent. The final exercise, or exercise number 8 of phase 2, are the shoulder pulleys. Here we are showing the motion without the pulleys. At home you would have the pulleys. You would securely have the pulleys placed over a door that is securely closed. Then you would have a chair against that door. The pulleys would then hang and you would be seated in this motion. So to begin the pulley motion, the left arm is going to extend and the right arm stays down. And then the left arm flexes and then the right arm extends. And so we'll show that pulley motion here maybe 5 times. So at home, you will have the pulleys overhead, and as the pulleys are overhead, you will continue with this motion. As you're doing this motion, it's important to keep your shoulders down and not let them elevate towards your ears. So maybe let's do 2 more. Pain is your guide. There is no limit or no precautions with this exercise. Excellent. That concludes phase 2.